Alright, let's get started. Number 12. Trepanation. Modern medicine says if you have a headache, maybe drink water, rest, check your blood pressure, or see a doctor. Ancient medicine sometimes said, have we considered drilling a hole in your skull? Trepanation is one of the oldest surgical procedures humans ever practiced. Archaeologists have found ancient skulls with neat holes cut into them, some dating back thousands of years to the Neolithic era. And the strangest part is that some people survived. You can tell because the bone around the hole healed, which means the person did not immediately die after someone opened their head like a coconut. Ancient healers believed headaches, seizures, strange behavior, and mental illness could be caused by evil spirits trapped inside the skull. So the solution was simple: open the door. They used sharp stones, scrapers, drills, and primitive tools to cut through the skull. And yes, many patients may have been awake for this. Imagine going to the healer with a headache and he says, "Good news, I know exactly where the demon is." Then he picks up a rock. To be fair, not every trepanation was spiritual. Some may have been used to treat head injuries or pressure after trauma, but a lot of ancient medicine mixed observation, superstition, and wild confidence. Sometimes the patient lived. Sometimes infection, bleeding, or brain damage ended the experiment. Number 11. Tobacco smoke enemas. History is full of bad ideas, but some bad ideas are so weird you have to respect the confidence. In the late 1700s, tobacco became popular in Europe, and people started believing it could treat almost anything. Then someone looked at tobacco smoke and thought, you know where this should go? The procedure involved blowing tobacco smoke into a patient's rectum. Yes, that was a medical treatment. In England, resuscitation kits were even placed along the River Thames for drowning victims. The idea was that if someone nearly drowned, tobacco smoke could warm the body and stimulate breathing. So instead of chest compressions, someone might be standing there with a pipe, preparing to turn your emergency into the most embarrassing moment of your life. It was also used for headaches, cramps, typhoid, cholera, and other illnesses. Basically, if doctors did not understand the disease, smoke entered the conversation. The logic was not completely random by their standards. They believed warmth and stimulation could revive the body. But the method was insane, and it could be dangerous for the person giving the treatment too. If the patient had an infectious disease and the practitioner inhaled at the wrong time, congratulations, the cure just recruited another victim. Modern CPR looks boring compared to this, but boring is good when the alternative is a tobacco pipe in the wrong location. Number 10. Urine mouthwash for teeth whitening. Ancient Rome gave us roads, aqueducts, concrete, law, military organization, and also people rinsing their mouths with urine. So, mixed legacy. The Romans discovered that aged urine could whiten teeth because it contains ammonia. Ammonia can act as a cleaning and bleaching agent, so they did the logical ancient thing. They collected urine, let it ferment, and used it as mouthwash. This was not a prank, it was hygiene in their opinion. Imagine a Roman person waking up, stretching, checking the mirror, and saying, "My teeth need that public toilet sparkle." Urine was so useful in ancient industries that it was taxed. It was used for cleaning clothes, tanning leather, and apparently helping people chase a brighter smile. And this was not only a Rome thing. Versions of urine-based remedies appeared in different places throughout history, because before modern chemistry, people were basically experimenting with anything that seemed to work. The disturbing part is that the Romans were not completely wrong about the ammonia. That does not make it less disgusting. It just means they found a real chemical effect using the worst possible delivery system. So today, you buy whitening strips, but back then, you had to pray that the mouthwash came from a reliable supplier. Number 9. Clitoridectomy for nymphomania. In the 19th century, some doctors claimed that women who were considered too assertive, emotional, rebellious, or difficult were suffering from conditions like nymphomania. A lot of these diagnoses were not real diseases. They were social judgments wearing a doctor's coat. One of the treatments was clitoridectomy, the surgical removal of the clitoris. Today, we recognize this as female genital mutilation. But in that era, some respected doctors presented it as legitimate medicine. Paul Broca, remembered today for important work in neurology, was also connected to this dark side of medical history. That is what makes it so disturbing. Someone can contribute to science in one area and still support terrible practices in another. Women were not always treated as full patients with full autonomy. Their pain was dismissed. Their desires were pathologized. Their behavior was controlled. If a woman did not fit society's idea of obedience, medicine sometimes tried to cut the problem out of her body. This was not healing, it was punishment disguised as treatment. And it is a reminder that medical history is not just a story of progress. Sometimes it is a story of people in power doing terrible things with official permission. Number 8. Gum lancing for teething babies. Teething babies cry, they drool, they get fevers from unrelated infections. They refuse sleep like tiny unpaid security guards. In the past, doctors saw babies getting sick around the age, Teeth appeared and decided teething itself must be deadly. So they treated it aggressively. And by aggressively, I mean terribly. One popular treatment was gum lancing. Doctors would cut open a baby's gums to help the tooth come through. The idea became associated with surgeons like Ambroise Paré and spread widely in later centuries. By the 19th century, some doctors believed lancing was essential. Some babies were lanced multiple times, not once, multiple times. They also used bleeding, blistering, and even leeches on infants. The real danger was infection. Cutting a baby's gums with old instruments in a world before modern germ theory could easily make things worse. The treatment may have harmed or killed many children it was supposed to save. The saddest part is that the doctors thought they were being responsible. Number 7. Bloodletting. For thousands of years, if you were sick, there was a very good chance a doctor would remove your blood and call it treatment. Bloodletting began in ancient medicine and became deeply tied to the theory of the four humors. The body, they believed, contained blood, phlegm, yellow bile, and black bile. If these were balanced, you were healthy. If they were unbalanced, you were sick. So if a doctor thought you had too much blood, the solution was to let some out. This could be done with a lancet, cupping, or leeches. Now, leeches do have real modern medical uses in specific situations, but historical bloodletting was used for almost everything. Fever, bleed. Infection, bleed. Pain, bleed. Already weak and pale? Somehow, still bleed. It became the medical version of turn it off and on again, except the thing being turned off was your circulation. George Washington is one of the most famous examples. In 1799, after he became seriously ill, doctors removed a massive amount of his blood. They also used other harsh treatments. Many historians believe the treatment likely worsened his condition and may have helped kill him. Number 6. Lobotomy. The lobotomy is one of the darkest chapters in modern medical history because it did not happen in ancient caves or medieval castles. It happened in the 20th century. Portuguese physician Antonio Egas Moniz developed the procedure in the 1930s. The idea was to treat mental illness by damaging connections in the frontal lobes of the brain. The frontal lobes are important for personality, judgment, emotions, planning, and decision-making. So, naturally, the treatment was to destroy part of that system and hope the suffering stopped. Early methods involved drilling into the skull and damaging brain tissue. Later, the transorbital lobotomy became famous, where an ice pick-like instrument was inserted through the eye socket area. That sentence alone should make everyone in the room sit down. Some patients became calmer, some were easier to manage. But many were left with severe personality changes, apathy, brain damage, seizures, loss of independence, or emotional emptiness. The tragedy is that many patients were vulnerable people with little ability to refuse. Families, hospitals, and doctors sometimes saw lobotomy as a solution to difficult behavior, not just illness. Moniz even won the Nobel Prize in 1949, which is one of those moments where history looks at you and says, progress is not always clean. The lobotomy reminds us that medicine can be dangerous when desperation meets overconfidence. Number 5. Heroin cough syrup. In 1898, Bayer marketed heroin as a cough medicine. Yes, that Bayer. The company promoted heroin as a useful treatment for coughs, and as a supposedly safer alternative to morphine. This is one of the most painful examples of aged badly in pharmaceutical history. People could use heroin preparations for coughs and respiratory problems. It was sold before modern drug regulation became strict. At the time, many people did not fully understand its addictive potential. Then reality arrived. Heroin turned out to be highly addictive. So imagine going to the pharmacy because you have a cough, and the solution turns your small problem into a life-destroying dependency. The United States eventually banned heroin for medical use in the early 20th century, but the damage was already done. This case shows why drug testing, regulation, and long-term safety data matter. A substance can seem useful at first and still become a disaster when used widely. Number 4. Electroconvulsive therapy without anesthesia. Electroconvulsive therapy, or ECT, is still used today in a much safer and more controlled form. Modern ECT uses anesthesia, muscle relaxants, monitoring, and careful medical supervision. For some severe depression cases, it can be effective. But the early version was terrifying. In the 1930s and 1940s, patients could be strapped down and shocked without anesthesia. The electric current caused seizures. Without muscle relaxants, those seizures could be violent enough to cause broken bones, injuries, and lasting fear. The procedure was developed by Italian neurologist Ugo Cerletti and his colleague Lucio Bini. The idea came partly from observations about seizures and mental illness. But early psychiatric care was often rough, experimental, and frightening. Patients in mental hospitals had little power. Treatments were sometimes done to them more than with them. So even when ECT helped some people, the way it was first practiced could be brutal. Imagine being depressed, confused, or psychotic, and the treatment offered is, we are going to strap you down and shock your brain until you seize. That is not the image of healing most people have in mind. The modern version is not the same as the old version, but the old version deserves its place here because it shows how a treatment can begin as something traumatic before medicine learns how to make it safer. Number 3. Arsenic and mercury treatments. Old doctors loved poisoning people very slowly and calling it therapy. Arsenic was used as medicine for thousands of years. Doctors prescribed arsenic compounds for fevers, ulcers, malaria, psoriasis, syphilis, and other conditions. The problem is that arsenic is also a famous poison. It was so associated with murder that people called it inheritance powder, because apparently nothing says family drama like secretly removing relatives from the will and the earth. Arsenic has a very narrow safety margin. A little might affect symptoms. Too much damages the body. Long-term exposure can cause cancer, nerve damage, skin problems, and organ injury. Mercury was another medical favorite. For centuries, mercury was used to treat syphilis and skin diseases. People rubbed it on, swallowed it, inhaled it, or were exposed through different preparations. And yes, mercury can make people very sick. It damages the nervous system and can cause tremors, mood changes, memory problems, and madness-like symptoms. That is where the phrase "mad as a hatter" comes from, because hat makers were exposed to mercury in their work. So the medical logic was basically, the disease is terrible. Let us fight it with something also terrible. Sometimes the treatment harmed the patient as much as the illness. Number 2. Boiled fox baths for paralysis. Medieval medicine had a theory that sounds like it came from a child explaining magic. If an animal had a quality you wanted, maybe that quality could transfer to you. A fox is quick and nimble, so if someone was paralyzed, the solution was apparently to boil a fox and bathe in the broth. Because nothing says rehabilitation like soup you should never eat. This idea was part of a wider world of symbolic medicine. People believed nature was full of signs. If something looked, behaved, or symbolized a desired trait, maybe it could heal that trait in the body. So a nimble animal might help movement. A strange ingredient might help desire. An owl mixture might help gout. One cure involved owl paste, made with owl, salt, and boar's grease. At that point, you are not receiving medicine. You are being seasoned. These treatments sound ridiculous now, but people took them seriously, because medicine was mixed with religion, superstition, folk tradition, and guesswork. And to be fair, they did not have MRI scans, antibiotics, or modern neuroscience. But still, if your paralysis treatment begins with boiling a fox, maybe the healer has lost the plot. Number 1. Dr. Henry Cotton's extraction method. This one is number 1 because it happened recently enough that it feels especially disturbing. Dr. Henry Cotton worked at Trenton Psychiatric Hospital in New Jersey in the early 20th century. He believed mental illness came from hidden infections in the body. Now, infection can affect mental state in some cases. That part is not completely absurd. But Cotton took the idea to a terrifying extreme. He believed that to cure mental illness, he had to remove infected body parts. So he started with teeth. Thousands of teeth. If removing teeth did not cure the patient, he moved on to tonsils, then gallbladders, then stomachs, then colons, then reproductive organs. This was surgery as an obsession. Cotton claimed a very high cure rate, but later investigations found serious problems with his data and a terrifying death rate. Many patients died from the procedures, infections, complications, or the physical trauma of unnecessary surgeries. By the end, thousands of teeth had been removed and hundreds of major operations had been performed. Cotton was not a random back-alley butcher. He was a respected doctor in an institution. People trusted him, patients were vulnerable, families were desperate, and the system allowed him to keep going for years. His methods were finally discredited, but not before many people were harmed. This is the dark side of medical history. The cure can become a cult. The doctor can become dangerous. And the patient, the person who most needs protection, can become the experiment. So next time someone says old cures were natural and gentle, remember this list. Sometimes historical medicine was not healing. Sometimes it was just torture with better handwriting. That is all for today. Subscribe to see our future videos.